Hello, everyone, and welcome to another episode of Wednesdays with the Doc. I am Dr. Daphne, and I am happy to share this space with you all today. So, I want to get started with just a little mindfulness activity to help us to reset and to recenter. So, if you are in a place where you can just sit comfortably, where you can, release the tension from your body and sit in a, relaxed, comfortable position. And if you are in a safe place and you feel comfortable to either soften your eyes or to close your eyes gently. And let's just take a moment just to inhale and exhale like you normally would. Just letting your breath flow in and out in its natural rhythm. And just take a few moments to unclench your jaw, to relax your shoulders, to drop your shoulders a little bit, to just let all of the tension flow from your body. And just continue to follow your breath in and out and refocus on this moment. This moment is the only moment that you have. This is the only moment or the only time that matters right now. And with your mouth closed, I want you to breathe in slowly and deeply through your nose, letting your diaphragm fill up on a count of 5. 5, 4, 3, 2, 1. And now with your mouth open, I want you to slowly release all of that air and exhale on 5, 4, 3, 2, 1. And let's inhale again. And as you inhale, take note of any sensations that you feel in your body. Take note of how it feels for you to inhale in that way. So we're going to inhale on 5, 4, 3, 2, 1. And now we're going to exhale slowly and deeply on 5, 4, 3, 2, 1. And now just continue to follow your breath. Inhale and exhale slowly and deeply with your normal rhythm. And just take note of any sensations that you feel in your body. Take note of any sensations that you feel in your throat. Take note of how it feels for you to inhale and exhale in that way. And now just take a minute to think about what you want to get from today's podcast episode. Now, with your eyes still closed, I want you to bring your awareness back into the space that you're in. So take note of any sounds that you hear. Take note of any smells or scents in the place where you are. Take note of any colors. And now I want you to softly and gently open your eyes. And as we do with each episode, starting with a mindfulness activity is a way to ground us and to bring us back into the present moment and to help us refocus and recenter on our day or the activity that we are currently engaging in. So September is National Suicide Awareness Prevention Month. And so I wanted to spend a little bit of time during today's episode to just talk a little bit about suicide, understanding some of the signs and symptoms, and then what to do if you suspect that a friend or a loved one, or even if you yourself are experiencing suicidal ideation or having thoughts of wanting to hurt yourself. And it's really important for us to understand that with suicide, there is a sense of hopelessness, where an individual may feel that suicide is the only option for them to stop the emotional pain. And I want you all to understand and know that there's always hope. And I know it's easy to say that there's always hope when you're feeling emotional pain, but there is always hope and there is always support to help the healing process from whatever it is that you're experiencing. And suicide is preventable. And it's preventable by seeking professional help to help you heal from the emotional pain. And as we talk about suicide, it's really important to understand some key terms so that we understand, what we're talking about, so that we further understand what someone may be experiencing. And so the first kind of term I want to talk about, or word, is suicide. We hear the word suicide a lot. We talk about individuals committing suicide or dying by suicide, but do we really understand what suicide is? And suicide is basically that act of killing oneself, or it's the act of direct violence at oneself with the intent to end your life and die because of those actions. When we talk about suicide, we also hear the term, or hear folks talk about suicidal ideation. And suicidal ideation is the thought of wanting to hurt yourself or harm yourself, or it's thinking about or planning suicide, planning out how you're going to do it, planning out when you're going to do it. And it's the thoughts, suicidal ideation are the thoughts connected to that plan for suicide. And then as we talk about suicide, we've also heard the term suicide attempt. And suicide attempt is when someone wants to harm themselves with the intent to die or end their life, but they do not die because of their actions. And so that is the attempt to end their life by actions of violence that do not happen. And so it's really important to understand each of those terms, to understand the difference between those terms, and to understand, how those terms connect back to one another and connect back to suicide. Now, as we talk about understanding the terms associated with talking about suicide prevention or talking about suicide awareness, it's really important that we also understand what some of the signs of suicide are. I am not going to go into all of them today, but I did want to give you a couple of signs to be aware of that you may readily see or notice in someone in your life. The first sign is going to be withdrawing from family and friends, losing interest in activities that were previously found enjoyable, withdrawing and pulling away from family and friends, giving away favorite possessions, and talking about being a burden to others. One thing to also note is untreated mental illness like depression, bipolar disorder can also be a risk factor for suicide. And so if you or someone are experiencing mental health challenges, diagnoses of mental illness, but you're not seeking help for that mental illness, that can be a risk factor, and it's really important to seek help for that. So that's another thing that you want to be mindful of as we talk about the signs and symptoms, is someone experiencing untreated mental illness that could be a risk factor for suicide, especially depression. And so what to do? We've talked about understanding what suicide is. We've talked about the signs and symptoms, but what do we do now? What are the next steps? So first and foremost, of course, I'm going to say seek professional help. If you or someone are really experiencing some challenges with, emotional pain and not healing from that, or just, challenges with coping with the difficulties or challenges of life, it's really important to seek professional help from a licensed therapist, whether that's a licensed clinical social worker or a licensed professional counselor or some other licensed mental health professional. And you also want to take advantage of suicide prevention hotlines that are available, such as 988. So you can text 988 and be connected to social workers, mental health professionals working on the National Suicide Prevention Hotlines. You can also talk to a family member or friend that you trust and let them know what's going on with you. And it's also really important for us to stay connected with our family and friends, and to be honest when we notice certain behaviors within our family members or friends that, may be a challenge, that may be a risk factor, that may speak to them having certain mental health conditions, or them having a mental illness, or us noticing where they seem like they may be suicidal. And it's really important for us to stay connected with our family and friends and to talk with them about those things when we notice certain behaviors. And so, as we prepare to close out this episode of the podcast, I also want to leave us all with some action items to work on in between now and the next episode. So, one is mood tracking. Mood tracking will help us all to uncover our patterns in our behavior. It will help us to identify when we're experiencing, certain moods on a regular basis. It can also help us to track how often certain things are occurring. So if we are experiencing symptoms of, say, depression, mood tracking will help us to keep track of how many days or how long have we been experiencing those symptoms. Mood tracking can also help us to recognize if we are having thoughts of hurting ourselves, or if we're having suicidal ideation or thoughts of self-harm. Mood tracking can help us to know how often those things are occurring. You can use the calendar app on your cell phone to note your mood each day, or there are some apps that you can use to help you track your moods. One app I use is called Daylio, Daylio. That's a great mood tracking app. It's very simple to use, and it can help you keep track of your moods, and also help you to see what things were occurring in your day that may have contributed to your moods. Another app is called Mood Tool. That's another tracking app and another resource to use to keep track of your moods. So mood tracking, I think, is really important to help us also understand what our functioning is, how we function on a day-to-day basis, what our baseline functioning is. And it helps us to, be aware when things change in our behavior, and also to help us know what next steps we should take. Another action item is to follow up with a mental health professional if you are experiencing any type of emotional pain or changes in your behavior that could be symptoms of depression or anxiety, or that, could be untreated, that's leading to, some thoughts of suicide. So finding a professional in your community is really important to help you get the support that you would need to manage those behaviors. And then another action item to do is just to connect with family and friends. As humans, we were all created to be in relationship with one another. I know that there are times where relationships can, they can seem tough and they can seem challenging, but we were all made to be connected as humans, and we want, our relationships and connections to be healthy. So I would really, suggest connecting with family and friends, spending time hanging out, having dinner, talking with one another as family and friends to keep those connections going. As always with each episode, I give a disclaimer that the podcast is not a replacement for therapy. So if you are finding yourself in distress or experiencing some, challenges in behavior or challenges in your day-to-day functioning, please seek out help from a licensed mental health professional. And as I close out the podcast, I just want to talk about how important it is for us to, be mindful and aware of these things, to understand that there's always help, especially if you are experiencing suicidal ideation, or if you are, at a place where you have not addressed some mental health concerns. There's always hope and there's always help. And so please take the opportunity to seek out professional help in your community, as well as connect with organizations like NAMI, the National Alliance on Mental Illness. They are a great advocacy organization for individuals experiencing mental illness, and they have a lot of great resources to help individuals navigate when they are experiencing mental illness or experiencing, challenges in their functioning that could lead to mental health concerns. So as always, I am so glad to be able to share this space with you all. Glad to be able to share some information with you today. As September is Suicide Prevention Awareness Month. And I hope you all take some time to take care of yourself, to engage in activities that promote your optimal health and well-being. If you are in the Northern Virginia area and you are looking for a licensed mental health professional, you can check us out at Loudon Counseling and Coaching. Our website is loudoncounselingcoaching.com. Telephone number is 571-375-0668. If you are not in the Northern Virginia area and you are looking for a licensed mental health professional, every county should have a local mental health agency. You can also